Do you think that healthcare centers and hospitals are only made of nurses and doctors? Well, I'm going to explain to you what happens behind the scenes. The medical information technologists, or in short, or abbreviation, MITs. I'm going to explain what an MIT is, how they increase safety in the centers, and also how they increase the quality of the job performances around the centers. I find that these key points are very important when it comes to thinking about this career choice because, well, they're kind of the key points that I had whenever I thought about this career choice. So, let's go ahead and go over what a medical information does. They, in short, take care of the paperwork. They're paperwork people, they're organized people. They prepare medical records and reports. They maintain files. They do order supplies, accounting procedures, and they do medical information, medical insurance and coding information. In this job field, you can do like just medical insurance, or you can do just the accounting part, but a lot of people go into all of the fields, or at least some of the fields, because it helps out not only your resume, but it can also help out the centers. The more you know, the more you can help out. So now that we have discussed the medical information technology, what it does, let's go ahead and go into the safety portion. How does medical information technology make it safe for the facility or the center? Well, it helps out the patients in so many ways. If a record is old and outdated, having a medical information technologist be able to catch that and ask the patient or the doctor to update the records can help us know our patients better and know what our doctors do better, so that we don't give out the wrong medicines or we don't do the wrong procedures on them, because it can harm them. If they get a medicine that didn't work before, it can cause harm in a couple of ways. One way, it doesn't work. Another way, it could react differently with different meds that they're on. It can react the same way as it did before, but just knowing what our patients and our doctors have done before and currently are doing will help our patients very, very much, so that we don't spread any diseases or sicknesses throughout the hospital, so that we know everything that happens between our doctors and our patients. The last part, the major part, I find is the quality. How is MIT worried about quality? Well, it's almost similar to the safety. Very similar, but this is more for the job aspect, more for the doctors and the other people that are working inside the hospital. If we keep our records accurate and our patients safe and very well taken care of, and making sure that everything, our paperwork is up to date, it helps drive improvement, it lower costs, it helps new development for patient care, it helps with making sure that the patient records are up to date and up to, healthcare standards, so that we're covering everything that needs to be covered whenever we're seeing our patients. But it also helps because having all these standards and all these new developments can be very tricky, by having your MIT there to be able to explain to you why this new development is happening or why this is changing can help ease the doctors and the nurses and the other people that are working inside the facility so that they're not scatterbrained or unsure of things. It just helps our patients more. So, lastly, now that we've discussed those topics, I hope you've learned something very important about what MIT does, how it increases safety for our patients and doctors, and how it also keeps the quality of our centers in top standards. Thank you, and have a great day. So I'm unsure if this is where we're supposed to ask the questions, so I'm going to go ahead and ask it inside my video. I'm kind of a rambler, or a mumbler, so if you could just tell me how I spoke. I fidget, so tell me if I fidgeted too much. I'm not really good at the public speaking thing, and I'm more of a back in the crowd kind of person. So just tell me what you overall thought and just give me your honest opinion, really. Thank you.